Hello everyone, this is Dr Alraies from SIF 2021. With me is Dr. Steven Yacubov. He is System Chief of Structural Heart at Ohio Health System. Steve, thanks for being with us.
Thank you.
Yeah, it's fine. Finally, we're back to life. We do interviews and we see you again. It's been 2 years. You gave a phenomenal talk about LAAO closure and what's the recent technology and what's the future. Can you please give us an overview?
Sure. Thank you for having me, first of all. It is good to be back live again. I did talk about the next generation left atrial appendage closure devices. We've had Watchman for so long.
Yes.
Now we're in the generation of the Flex device.
Yes.
And we're getting some other devices either in clinical trials, and there's a few others that are on the horizon that come along.
Yeah.
And then we've always had the one epicardial device called LAAO.
Yeah, exactly.
Yeah.
So you mentioned that to me before. We heard of it before.
Yeah.
We don't use it too much. What are the reasons are, and what is the new trial that's coming?
Oh, great. First of all, Watchman is the only one that's indicated for stroke prevention in patients with oral anticoagulation ineligibility that have atrial fibrillation, so for the prevention of stroke. Everybody else is trying to either get there or has an indication for tissue ligation, which is just closure of the appendage. LAAO has that indication for tissue ligation, left atrial appendage.
Right.
What is the advantage of Watchman? It's a very easy procedure to do. It's transeptal procedures, which we're all very comfortable with. And with the Flex device, it's very simple and safe. We use LAAO for patients who may need an adjunct to atrial fibrillation ablation. So we believe that with true necrosis of the left atrial appendage, perhaps the efficacy of AFib ablation will be enhanced and will be able to prevent the patency of the left atrial appendage. And that is being studied in a trial called Amaze, which should be out soon.
Okay, so the study is finished recruiting, and now you're going to be presented soon?
Correct. Over 600 patients have been enrolled. It's for follow-up for 1 year, and the primary endpoint is atrial fibrillation recurrence after ablation plus or minus left atrial appendage closure with the LAAO.
And part of the protocol, or when they submit for FDA approval, does this device require anticoagulation post-implantation or post-ligation?
That's a great question. We don't really know the answer to that. We're used to giving 45 days of anticoagulation for patients who have Watchman. These patients are atrial fibrillation ablation patients who often get anticoagulation for an unknown period of time anyway.
Yeah.
You know, until the electrophysiologists are sure that their AFib is not going to come back. So most of them do get post-procedural anticoagulation just because it's so close to the time they've had their ablation.
Absolutely. So we touched also, there was a nice session about ICE.
Yes.
What is the percentage right now of people using ICE versus TEE?
I think for closure of left atrial appendage with Watchman, I think the number of people and the percentage of cases that use ICE is pretty low, but it's increasing quickly.
Okay.
I think as people realize it can be done, our 4D ICE catheters are back out on the market. They were taken away for a little while. Now they're back on the market. There's some other vendors that are bringing out new enhanced technology. I think it'll be very common that ICE becomes a pretty significant competitor to TE for procedural characteristics of the Watchman closure.
Yeah, and do you think that will change general anesthesia to minimalistic approach as well?
I do. You know, we do half of our cases right now with ICE, and those patients just get conscious sedation and very minimal conscious sedation.
Right.
So I think it does improve patient outcomes.
Yeah. I just want to throw a random question. It's about the closure of the sheath venous. I hear different people say, per close, manual, figure of 8. What's your approach and the most cost-effective one?
Yeah, so personally, I use one single perclose for MitraClip cases that are 24 French or larger. Everything else, even if there's 2 venous access sites like Watchman when we're using ICE and the venous catheter, or PFO ASD closures where you use an ICE catheter, I use a single waggle. So one suture, I don't even tie it down to the skin, just put the stopcock down on top of it, and the nurses love it, the patients love it. You don't have to tie it down, so you could adjust it.
Yes.
So that before they go home, they could walk. Even if you could even send them home with it. The patients could pull it out themselves.
Oh, exactly.
So it's made it a lot simpler.
What is that technique called?
It's called the Waggle.
Waggle.
Yeah, the Waggle, and it's on YouTube. And you could, all it is a figure-8 stitch, and you don't tie it. You just put both ends through the stopcock, cinch the stopcock down.
I hear there's a company already looking into developing a closure like that.
Terumo has a device that's very similar to
Oh, really?
that. Yeah, but the stopcock's hard to beat as far as cost.
It's part of the package.
Yes.
Yeah, exactly. Well, thank you so much, Steve, for your time.
Thanks for having
and for
me.
being here. Please watch this video and others on SIF YouTube channel. This is Shadi Reyes from 2021.
Thank you.